Hi, I'm Dr. Liesel, and today we're going to show you how to approach pain or achiness in the upper back, especially between the shoulder blades. If you have new pain in the upper back, please first see a medical professional to make sure you don't have a cardiac or lung issue, a fracture or sprain that needs any kind of medical treatment before you try and treat this yourself at home. This app is not intended to take the place of your qualified healthcare provider, and any use of this app is at your own risk. Around and over the chest wall, we have a layer of muscles that affect how we breathe, as well as our posture and how we move. There is a constant interplay between the various muscles. With how people work, sit, and use their bodies, the pectoral muscles often get tight and contracted because our arms are working in front of us. This is especially true for office-type work on computers where people are typing for most of the day. Some areas you will be able to treat exactly where you feel a restriction or discomfort, and others you will feel the result of the tension and not the cause. Firstly, the areas that localize well. If you take a deep breath in and see if there's anywhere around the chest, front or back, that feels tight or restrictive. The most common areas are along the sternum and just underneath the breast tissue, and up and down the sides of the body underneath the arms. Areas that you can feel are tight or achy by taking a deep breath can be treated directly over the area where you feel the restriction. Take your massage device, take a deep breath in and see where you feel that restriction and massage gently but firmly right onto the area. You can take this while taking a deep breath to also create a bit of stretch in the tissues while you massage. If you find that your pectoral muscles tend to get tight and create a slouch, then go to the stretches in the app and I will show you an easy pectoral stretch that you can do quickly during the day to keep things limber. Secondly, if you feel a constant ache or a general tension between the shoulder blades, then you will first want to treat the areas that make this area strain and work hard. These two areas are the pectoral muscles, which I would treat first, and then the muscles on the sides. These are called the anterior serratus muscles. The anterior serratus muscles run down the chest wall under the arms. They pull the shoulder blades forward and create a lot of tension in the muscles at the back between the shoulder blades. So first you're going to treat the pectoral muscles on the front of the chest between the shoulders. You're going to start at the side of the shoulder and work your way in and go in straight lines across the shoulder, as she's doing there, across the pec muscle. You're going to start just underneath the collarbone and work your way down until you start getting, for the women, into the breast tissue. The men can go lower down over the pec muscles. While you do this, take a deep breath so that you get a bit of a stretch across the chest wall while you are releasing these muscles on the top.